Hi, my name is Emelita Bonilla, and today I will be discussing the gaps in knowledge, suggestions for further research, and conclusion related to the measles virus. One gap in knowledge surrounds the topic of vaccinations. The 52 cases of measles that originated at Disneyland was an extreme wake-up call for those who didn't understand how vaccines work. The vast majority of the infected individuals were unvaccinated, and only 6 were vaccinated who acquired the disease. According to the CDC, the vaccine is 97% effective and is one of the most effective vaccines in the world. However, very few people, about 3 out of 100, who get the 2 doses of measles vaccine will still get measles if exposed to the virus. Experts are not sure why this happens, but that it could be that their immune systems didn't respond as well as they should have to the vaccine. This brings us to the topic of herd immunity, which is the resistance to the spread of a contagious disease within a population that results if a sufficiently high proportion of individuals are immune to the disease, especially through vaccination. If more people opt to not get vaccinated due to various reasons, including religious reasons or the fear the vaccine will have harmful effects based on discredited studies, this will create more chances of the virus to spread rapidly. This first chart shows the outcomes of certain barriers for people not getting the vaccine, and we can see that the weighted 79.8% of patients or parents consider that measles is a harmless disease, and 50% fear that vaccination has side effects. This second graph shows a timeline from 2000 to 2014 and the huge increase that happened in 2014 of confirmed measles cases when the vaccines were at a decline. According to the CDC, vaccine exemptions tend to cluster geographically, making some communities at greater risk for outbreaks. Further research could include considering strengthening the difficulty of the application process to be opted out of receiving the vaccine, and also have substantial healthcare practices like discussing in depth with hesitant parents about vaccinations to educate them. Provider outreach and public education about vaccines should be a high priority to help eliminate measles altogether. The measles virus is far from being eradicated and remains a deadly hazard for many. A lack of access to the vaccination or not wanting to have the vaccination is what makes this disease a continued health risk. Measles deserves the $100 million for distribution and application of the vaccination in third world countries where the virus remains prominent. With enough funding, thousands of lives can be saved. Thank you for watching.
Brought to you in part by